Good day, everyone. This is the Workers' Compensation Legal Side podcast with Richard and Paul.
Hello, everyone. My name is Paul Taylor. I'm a paralegal with a specialization in workers' compensation and human rights law. If you want to reach out to either of us or be part of our podcast, like our special guest today, you can contact us through the links below. This week's topic, this week's topic is occupational disease with our special guest, Alec Farquhar, and I hope I didn't butcher your name, Alec, coordinator of Asbestos Free Canada and activists with Canadian Aerosol Transmission Coalition. Funny how I goofed up activists. Go ahead, Alec.
Let me just
Oh,
pop
sorry,
in
Richard.
and say that Alec has been representing injured workers for the past 50 years,
Oh,
in part at leading the uh, government organization that represented injured workers, and in part even working at the WSIB when the NDP was in power. He worked in the chairman's office, so Alec has a lengthy history of dealing with WSIB matters.
Didn't
Alec,
you run the OWA?
yes, the OWA. Alec, take it away.
Hmm.
And I was managing director of the Occupational Health Clinics for Ontario Workers, OHCOW. And I was the director of the Ministry of Labor Occupational Health and Safety branch. So I've had a lot of activity on the prevention side as well. So very briefly today, I'll outline the way forward for compensation and prevention of occupational diseases. And then whatever comes up in the discussion, I'll be very pleased to participate. And thank you, Richard and Paul, for inviting me, and Pam for your endless support for this process that keeps it going forward. So, if you sort of take the big picture of occupational disease, it can be seen as a specialized area. It's the interface of the medical and legal systems. And there are lots of challenges in that, which I won't speak to. They're in my presentation that will be circulated with the materials. But what I wanted to focus on here is that there's a tremendous undercompensation for occupational disease. There are a whole lot of reasons for it, but I really do believe the underlying reason is the tremendous cost of doing so. Currently in Ontario, as documented by Dr. Paul Demers in his 2020 groundbreaking report, it appears that there are around 3,000 fatal occupational cancers in Ontario every year, 3,000 families affected, 3,000 workers affected, and currently we compensate fewer than 200 of those. In other words, the vast majority of occupational cancer goes uncompensated. There's another groundbreaking study by Professor Emile Tompa and his group, which documents that the annual cost in Canada just of asbestos cancer from work is $2.3 billion, $2.3 billion a year. If you take Ontario as even 20% of that, it's over $500 million just from asbestos. If employers had to pay the full cost of that, it would challenge the whole financial underpinning that has been allowing the WSIB to give huge multi-billion dollar rebates to employers over the last few years. So this is not a small issue. It's technical, but it's also very simple. People are getting sick and dying. It's from their work to a very significant extent, sometimes predominantly from their work. And they are not getting compensated. So they and their families are bearing the cost. And then the taxpayer and the rest of society, the rest of the cost. So it's a really big issue. And what I want to do is focus right now on the way forward. I'm glad to talk about any aspect of the current context or where we might want to go, but I'll focus on the way forward in the next couple of minutes. So we need a much better system. In Ontario, I believe I calculated it again this morning. I believe we have only 4 cancers in our schedules 3 and 4. 4. There are European countries that have 20, 30 or more in their schedules, the equivalent approach. So here, if you get most cancers, you have to prove your case positively under a board policy rather than getting the benefit of a presumption, either a rebuttable one or an irrebuttable one, that it's work-related. So that's really the core of the reform struggle that we need to move forward with. I'm really a strong advocate of viewing occupational disease broadly. It's very often seen in the media and among members of the public, quite understandably, as being primarily cancer. But it's way more than cancer. I'm involved with the Canadian Aerosol Transmission Coalition. That's about COVID-19 and airborne transmission. That's an infectious disease, but you can get it at work. That makes it an occupational disease. You've got dermatitis, which sounds like, oh, you get a rash on your skin. But anyone who's seen a serious dermatitis case where people's skin and tissue is being literally devoured, it's a horrible thing to see. And that's an occupational disease. Hearing loss, asthma that's made worse by work exposures or maybe even caused by work exposures, silicosis from working with artificial stone in the hundreds of condo buildings going up around the province where there are often unsafe practices with artificial stone. Heat stress, we're just finishing a summer of that, and the terrible health impacts. The health impacts of wildfire smoke for people working outside and when it gets into buildings. And then, of course, poor air quality overall. So add all that up, and you've got a lot of people getting sick, a lot of workers and families affected. And I've mentioned some of the dollars and cents. Just as one estimate, if we compensated half of the occupational cancer fatalities in Ontario every year, that is, we compensated 1,500 instead of 200, at 500,000 a case, that's $750 million. That alone would threaten the financial underpinning of rebates to employers. So where do we go from here? I'm a strong advocate of alliances for prevention and compensation. We tend to base everything on the victims, the injured workers, and our labor movement allies, and that tends to be who we work with. And I, of course, believe we should go way beyond that. And I'm especially interested in allying with organizations concerned about these various health conditions. So organizations concerned about cancer, asthma, dermatitis, infectious diseases, poor indoor air quality. For example, that includes the parents of children in schools that have terrible air quality. So the kids are literally falling asleep at 2 in the afternoon and they can't concentrate. We also need to raise awareness of occupational exposures among healthcare providers. We should pay them to take good occupational histories from patients. We really need a reform campaign, as I mentioned earlier, focused on the greater use of presumptions to make it easier for workers to get compensated and take account of what I call combined and synergistic exposures. It's very common to focus on one exposure that a worker has and not take account of all the other exposures that work together to make them sick. We need to fund OHCOW, the unions, and victims groups to increase community engagement and awareness raising. We need to recognize employers that are willing to eliminate harmful exposures and substitute safe alternatives and give them some financial support in doing that as part of the Carney government National Industrial Strategy. And an example of a broad approach would be a national effort to improve indoor air quality by better ventilation, air filtration, and remediation. And that can target asbestos, airborne pathogens like COVID, radon, high CO2 levels in schools that affect workers and the students, and wildfire smoke. So I'll stop there, Paul and Richard, and we'll take this wherever you want to take it.
Let me ask you about the appeals tribunal decisions. So the one that I'm recently familiar with is a person who did welding, and the welding fumes contained benzene. And then the question always becomes, if you're claiming that you got bone disease from the benzene exposure, sort of a bone cancer, how much benzene were you exposed to? And the problem becomes is because there's not sort of an onus on the employer to disprove inadequate benzene. It's up to the worker who hasn't worked there in, say, a year, to try and say how much benzene there is. Because if there's not enough benzene, then they'll say that the bone cancer is congenital or from some other cause, not the work exposure. So how would you get to the point where you can actually do the calculation?
So this is close to the core of when the big statistics meet the individual case. So the big statistics on benzene exposure are extremely strong. Benzene's a carcinogen recognized for decades. But as long as you don't have a presumption of work relatedness to help the worker has to positively prove the extent of exposure and whether that could have caused a health impact. So I have a couple of comments on that decision. First of all, it's a typical example of a focus on one aspect of exposure. Anybody who knows welding knows that it is a multiple carcinogen and multiple substance type of exposure. There's way more involved than benzene. An interesting thing about benzene is that it is in Schedule 3. Benzene's listed. Specifically, it's listed, it's item 13 in Schedule 3, but it's called poisoning and its sequelae by derivatives of benzene, phenol, or their homologs, and it's all about poisoning. So it's fundamentally the sort of initial, more acute phase of exposure to things. And if that does occur, you've got the benefit of a presumption, but the presumption, unless you can interpret sequelae as meaning cancer, doesn't apply. So benzene is just a classic example of something that should be in the schedule, related to certain cancers, and by the way, should specifically be noted as a very common component of combined or synergistic exposures. In other words, benzene plus some of the metals that are in welding fumes and some of the other substances that are contained, depending on the type of welding you're doing.
Alec, can you explain what you're talking about, Schedule 3 and 4, for people that don't know what you're talking about in reference
That's to yeah, that's a really good idea. A lot of people may not be fully aware of the way our legal system is structured. Essentially, the legislature passes legislation. In the case of workers' compensation, the Ontario legislature passed legislation long before any of us were born, 1914. Then it was called the Workmen's Compensation Act. And quite early on, regulations were passed by cabinet, which were made pursuant to that legislation. So we have a general regulation and some other regulations passed by cabinet, not by the legislature, pursuant to what is now called the Workplace Safety and Insurance Act, what used to be called the Workers' Compensation Act, which is what I think it should be called. And under the general regulation, there are a number of schedules. The important ones for our purposes are Schedules 3 and 4. Any health condition listed in Schedule 3 where a person gets that health condition from involvement in a process of work on the other side of Schedule 3. So in the case of benzene that we were just talking about, the health condition mentioned is poisoning and its sequelae, and the process is any process involving manufacture, handling, use, or exposure to nitro or amino derivatives of benzene, phenol, or their homologs. So you get the health condition and you're involved in the process, it's presumed that your health condition came from that process, unless the contrary can be shown. So then that shifts the burden to the board and the employer to prove that your health condition didn't come from work. That's a very powerful support. And Schedule 4 has an even more powerful impact. There are only a few things listed in it. And in Schedule 4, if you get the health condition and you worked in the process, so in the case of asbestos in Schedule 4, the wording is If you get a primary malignant neoplasm of the mesothelium of the pleura of peritoneum, and you worked in mining, milling, manufacturing, assembly, etc., a process involving the generation of airborne asbestos fibers, it will be irrebuttably presumed that it came from your work. In other words, you get mesothelioma and you used to work in a job where you were regularly generating airborne asbestos fibers, just such as, I don't know, cutting asbestos cement would be a typical example. Installing asbestos cement pipes. Then you get compensated, and there's no rebutting the presumption. It's very, very powerful. It's automatic compensation. And every year, anywhere from 50 to 100 Ontarians gets compensated for mesothelioma under that provision. And I've seen cases granted within an hour of being submitted. That's how fast it can happen. And if you're going to die from mesothelioma in the next few months, knowing your family is getting the financial support and knowing they're getting the healthcare support that they need is a tremendous contribution to the well-being of that family in a terrible circumstance. So that's what we're talking about with the presumptions. We need a lot more presumptions covering a lot more health conditions and a lot more cancers. And by the way, not just cancers, other health conditions that are significantly disabling.
But why do you say that? Like, is there a benefit to, and answer it is, to taxpayers and workers to make these presumptions?
There's two vital impacts of this. When the workers' comp system truly reflects the cost of what workplaces are doing to workers, that's a tremendous incentive for prevention. If you can kill or injure a worker, and it basically doesn't cost you anything on your workers' comp premium, well, where's your incentive? You'll feel like a chump. Some other employers investing all kinds of money in prevention, they're paying all that money. They're competing against you. You don't invest a penny, knowing that if your workers get killed or injured, there's still no cost to you because the system doesn't recognize it. It's essentially an incentive to a third world occupational economy, let's call it. And so that's just the general incentive. When the system doesn't recognize the cost, those costs don't go away. A large proportion of them are borne by the worker or their family or those close to them that rely on them. And the rest of the cost is borne by the taxpayer. So if a mesothelioma patient costs $400,000 for advanced treatment and the board isn't paying for that, well, guess who's paying for it? You and me. The cost doesn't go away.
Yeah.
So, Alec, you got the Mesothelioma Foundation gathering and fundraising dinner on Wednesday, September 17th. I see that one of the things you're funding is research. What's lacking in the current research, given that asbestosis and cancer have been looked at scientifically for the last, say, 60 years?
A lot of the research, I'm really glad, Richard, you mentioned that. I'm on the board for the Canadian Mesothelioma Foundation. I got involved with that foundation, which is a really great organization, a number of years ago, because I'd seen so many people affected by mesothelioma, which is almost always fatal. Most of their research is on, they don't do research, they fund it, is done on the earlier detection of mesothelioma. That is, blood tests and other ways to detect it way earlier. And believe it or not, they're even looking now in the medical system at a vaccine to help prevent mesothelioma once you've been exposed to asbestos. So a lot of it's about detection, prevention, treatment, because once you've been exposed to asbestos, there's a good chance you'll get mesothelioma, and all that can be done is to protect you the best possible from getting sick, or if you get sick, extending your lifespan. So that's a lot of what the research is about. It's not particularly about the way you get at mesothelioma, although researching how mesothelioma develops in the body can be important in preventing exposure, but we already know you shouldn't be exposed to asbestos.
One of the questions I see from time to time is the worker cannot point out to any particular exposure at work, and yet they get mesothelioma, which is obviously from asbestos. Like, if they didn't get it from work, where did they get it? And these type of cases generally fail. There's sort of this onus on the worker that still has to point out some work exposure. Am I getting that right?
Yeah, the first of all, there are definitely some mesothelioma cases that do not come from occupational exposure. So, for example, if you, as a young child, had talcum powder from an earlier generation when there was some contamination from asbestos, you could get mesothelioma today, and the cause of that mesothelioma was talcum powder. It wasn't work. You can also get mesothelioma from asbestos fibers that come out of the workplace in some fashion. Maybe they just literally get blown onto a schoolyard or brought home on somebody's work clothes. So there are quite a few people who are either secondarily exposed to occupational asbestos or exposed directly to asbestos, which is of environmental origin. So those cases absolutely exist. The majority are still from work exposure. My own personal belief is that for at least asbestos and a couple of the very worst carcinogens, the process description in the schedule should be revised. And if you get mesothelioma and you worked in a broader range of situations, so for example, a case that we had a while back, somebody worked, I believe it was in a theater, and there were workers doing some renovations, and some asbestos was disturbed. So this worker didn't work with that asbestos at all. They were simply working in the area, got exposed, got mesothelioma, and pretty well for sure that's how they got their mesothelioma. So expanding out the process description would be very helpful, because lots of people are exposed sort of secondarily or along the way to asbestos at work. They're not directly working with it the way you would if you were basically cutting or in some other fashion altering an asbestos-containing material to generate airborne asbestos.
What?
And by the way, there should be advanced. We love to think that the U.S. and Canada are advanced economies, but in many ways we're not. In Europe, there are several countries which have compensation schemes for the victims who aren't covered by the workers' comp legislation. I'm quite familiar with the Italian one, just for example. It's not as generous as it could be, but it does exist. And essentially, it's publicly or employer funded. And if you aren't getting compensation under the workers' comp system, you're eligible for we'll call it the civil claims, and there's at least something for you and your family.
I remember hearing from the victims in that city where they had the asbestos plant, where the children and the wives were all getting asbestosis because the parents were bringing it home on their clothes.
Yeah, we brought a delegation from the city of Casale Monferrato to Canada in 2019, so 6 years ago. That's a city where 10% of all the people in the city, 10% of 30,000 people, have been killed by asbestos. And as Richard, you just said, it's men, women, children, it's occupational exposure, environmental, any kind of exposure you can think of. It's a world-class occupational, completely preventable occupational tragedy.
That brings a bigger question. You've been talking mainly about the individual, meaning the worker. Say I'm the worker and I get exposed. And when we think of injured workers in the workplace and workplace accident or exposure, we're always thinking of just the worker. We don't look at the impact and exposure to their family members or even friends. I realized that when I read the book Pain and Prejudice, What Science Can Learn About work from the people who do it by Karen Messing. It's an excellent book. And in the first chapter, she talks about workers in, I believe it was Quebec, that they were literally having children with birth defects and everything. And I'm like, this, from the legal twisted mind that I have, this brings in a very interesting legal question is, if you're affecting other people who are not workers, is it workers' comp now or is it a civil claim against the employer? I don't know. But my point to this is it's a greater problem with occupational disease exposures to not just the workers. You know what I mean?
You're totally right. And it's very important territory. In a podcast like this, we don't have an opportunity to go deep into the topic of alternative civil actions. There are a lot of situations where there may be an alternative civil action. And by the way, for asbestos, also a claim against the American trust funds, which can be a significant amount of money. And then how that interfaces with the workers' comp system, that's a topic for probably several podcasts. But the fundamental of the broader impact of especially carcinogenic exposures, it's a very, very significant issue. And I believe there's research now showing that some of the genetic changes that come from chemical exposure at work can be passed on through the generations. They don't even necessarily end with just your own children.
Yeah.
So it's a terrible, terrible impact to which not enough attention is paid. Again, Europe, there's more attention to it. Here, almost none.
What research is the WSIB funding on this topic?
Yeah, there's significant research funded by WSIB, but not enough, in my opinion. But we've got some really great research resources in Ontario. We have the Occupational Cancer Research Centre, led by Dr. Paul Demers. Nationally, we have CAREX Canada, which documents workplace exposures to carcinogens. We've got the Centre for Research Expertise in Occupational Disease here in Ontario, which deals with some of the other occupational diseases such as dermatitis and asthma. There's a lot of research. I personally think fundamentally the research is there. There's always more research that can be done, but really we need the system to respond properly to the true extent of OC disease. And remember what I said earlier, OC disease is COVID-19, long COVID that you got. The start of it came at work. It's heat stress. It's hearing loss. It's dermatitis and asthma. It's a wide range of health conditions way beyond cancer. And it probably affects hundreds of thousands of people in our province at any given time. So it's a big, big issue.
But Alec, in looking at, for example, asbestos in buildings, I was shocked to find out, okay, I'm naive, like most people, ignorant to the reality of our environment, in that when I go into many buildings, they're literally covered in asbestos. I mean, it puzzles me that companies or governments aren't doing like we do with restaurants today and saying, this restaurant is safe to eat at, and well, maybe not so safe. Like, it just seems to me a very simple fix to, at the very minimum, if you're not going to deal with it, then at least have a right to know for guests, workers, people. You know what I mean? Like, shouldn't I have the right to know when I'm working in a workplace that I'm working with possibly carcinogens, whatever? Like, I mean, I've heard of horror stories of workers who work with concrete, and I'm like, concrete? And they go, yeah, no, you wouldn't believe the stuff we work with that's extremely dangerous. And I'm like, wow. I understand there's WHMIS and that stuff, but for my opinion, it doesn't go far enough. There should be signs saying this building or this workplace has this, because you might have WHMIS and you're working with it and you know how to deal with it. But dumb truck driver Paul coming in doesn't know anything, because we're just told to go there, pick up the load, and take it over here. And if you have any questions, tough. Yeah, we get WHMIS training, but generally we're not told, hey, at Alec's workplace, they deal with this, and if it opens up or whatever, you better run, you better have PPE. And that's why I think it should be a warning. What do you think?
I think you're really onto something. Uh, I think another document I'll just send along to Pam for the materials is the current proposal from Asbestos Free Canada for a Canadian asbestos strategy. A prominent part of that strategy is a registry of all locations where there may be asbestos exposure, and it would be signage exactly like you're indicating. But the signage, I totally agree, should be broader. People should know any important place they go into, much less they go to work at. There should be very public notification of what the exposures might be. And I personally think that would be a big incentive to prevention and ultimately eliminating these exposures. Uh, and again, there are other countries doing a way better job at this than we are. What we're doing is pitiful, actually. So Australia has a national asbestos elimination strategy that's been going now for about 15 years. They have a dedicated agency for the elimination of asbestos. They've done a really good inventory of where their asbestos is. Of course, this needs to be applied to other substances, but it's a good start. And we have nothing that's that coordinated. We have some legal requirements for notification and for, I guess we'll say, review over the years of how the asbestos is doing. It's not like we have nothing, but the regime is pretty poor compared to some other countries. Italy's got some really good documentation of asbestos locations that, interestingly, compared to Australia, Italy's documented where the asbestos is, but they don't have the funding. So you've got buildings from 30 years ago full of asbestos and nothing's been done about them. Literally, maybe the asbestos is just still lying on the ground inside them. So funding is vital. You can't just have a law on the books. It has to be properly implemented.
I just wanted to conclude with, I think, my best story from Paul Weiler. He was the head of the Workers' Compensation Board and Health and Safety System in British Columbia in the early 1970s. And he was trying to reduce the amount of exposure the workers had from chemicals while they were at work in, I think, the pulp and paper industry. And then he made a ruling that they have to stop spewing the chemicals out of the smokestacks at the plant because they were killing the workers when they were at their homes. And when the social credit was elected, he was terminated from his job a day later.
There,
So this
there are
fight
so
goes
many
back
horror
as
stories.
long as me and Alec have been around doing this type of work. So thank you very much, Alec, and
Thank you
look forward
both.
to
Thanks for
seeing
having me.
you.
And thank you, Pam.
We'll
Thanks.
have to have you back on again because, like you said, it sounds like your topics, just even from my perspective, which I know about this much, is massive and it'd probably take a multi-part series or something. Because to me personally, not being exposed, as far as I know, to any diseases or occupational disease, I'm literally personally really concerned, and I think all Canadians in general should be. And I thank you for your advocacy. I really do.
Great. Thank you all.
Goodbye.